Okay, well, welcome everybody. This is our Freedom to Serve panel discussion. We are here today with several folks who are representing different groups who work with veterans, service members, and their families. I'm hosting on behalf of Modern Military Association of America. My name is Rachel Branaman. I'm the Interim Executive Director. MMAA is the nation's largest organization of LGBTQ service members, military spouses, veterans, and their families, as well as allies. We work to make a real difference in the lives of our modern military families through education, advocacy, and support. Puja Van Epps, MD, uses she, her pronouns, and she is a medical director for the LGBTQ Health Program Office for Veterans Affairs. And a little bit about Dr. Van Epps. She is an infectious disease trained physician. She received her medical degree at the Virginia Commonwealth University and completed internal medicine and infectious disease training at the Case Western Reserve University in Cleveland, Ohio. She's a staff physician at the Northeast Ohio Healthcare System in Cleveland, where she serves as the HIV lead clinician and an associate professor of medicine at Case Western Reserve University. In her role as the LGBTQ health medical director, she serves as the clinical subject matter expert and provides coordination of best medical practices across the program nationally related to healthcare delivery for LGBTQ veterans to the system to improve quality of care and reduce health disparities for veterans. Susan Mejia-Flores, she uses she, her pronouns, and serves as the Transgender Care Program Manager for the LGBTQ Health Programs for Veteran Affairs. She previously served for 8 years in multiple term positions with the program office, coordinating specialty training and consultation on transgender healthcare. And she's also a U.S. Army veteran. And Ashley Carothers uses she, her pronouns, and serves as the Management and Program Analyst. She's the LGBTQ Liaison for Veteran Affairs Center for Minority Vets. Ashley is a highly accomplished professional with a diverse background in nonprofit management, outreach and engagement, diversity, equity, and inclusion, and logistics management. She has a passion for making a positive impact in communities and has dedicated her career to driving organizational growth, fostering inclusive environments, and ensuring efficient operations. Ashley served in the United States Air Force, where her experience in logistics management began, and she has a degree in psychology, certificates in DEI in the workplace, and inclusive and ethical leadership, and continues to stay up to date on the latest trends and practices. Alleria Stanley uses she, her pronouns and serves as the Director of Advocacy for SPARTA and is Vice Chair of the Board of Directors for Transgender and Diverse Veterans of America. She is a 20-year retired member of the U.S. military. She's transgender herself and a mother of 2 transgender children. A combat veteran with a military career in the medical field, her efforts have been tireless to care for her patients and fellow service members. As a mother of 5, she's been a strong advocate for children and families throughout her career. As a caregiver at home and a leader at work, situations consistently present themselves for her to nurture and problem solve those for whom she cares and is responsible. Through her work with organizations such as SPARTA, her efforts are consistent towards improving the lives of the LGBTQ members of the military community, be they service members or their families. Post-retirement, Alleria is focusing on continuing her work in LGBTQ advocacy with a focus on the military community and particularly transgender members of the military, their families, and veterans. And now I'm going to tell you a little bit about the Freedom to Serve Guide before we jump into the panel questions. We have a link available, which you can download on Modern Military's website. Since the summer of 2020, MMAA has been working to update our latest edition of the Freedom to Serve, the definitive guide to LGBTQ military service. It is an essential toolkit for LGBTQ recruits, military personnel, veterans, and their families to know their rights, as well as a resource for policymakers to remove barriers for military service and access to the benefits that service members and veterans have earned for their service to our country. It has nearly doubled in size since its last publication in 2017 and includes new sections and resources such as expanded and updated information about open service for transgender people, updated information on how service members can access HIV prevention resources such as pre-exposure prophylaxis, also known as PrEP, and post-exposure prophylaxis. New information pertaining to veterans benefits and LGBTQ inclusive care through the VA, relevant updates for service members living with HIV, including discussions about recent circuit court updates, and expanded roster of resources with new resource recommendations for intersex, asexual, and aromantic people, among others. And finally, recommendations for how the Department of Defense can continue to support the needs of LGBTQ service members and veterans. So I'm really excited to have you all here, and we're going to start by asking a few questions as it relates to the work that you're doing. I'm going to start with you, Alleria. The Freedom to Serve Guide includes new information about transgender service. Can you speak to your experience in accessing these services and any barriers you may have faced?
I was muted. Thank you. I came to the service when transgender people were not allowed to serve openly. And so that was the first barrier. And for now, thankfully, it is no longer a barrier. And we're hoping to keep that policy in place that transgender persons continue to serve their country openly and fully. But once we were allowed to serve, then it was like, okay, so what are the rules? What are the policies, and what kind of care can I receive? And through the several administrations which have governed transgender service in the military, it's been a little bit of bouncing back and forth and figuring it out as we go. And of course, policy changes as Congress and the president have changed their guidelines. The nice thing I found in this Freedom to Serve Guide is it's very much coalesced to help find those resources. And there are so many sources because unfortunately, transgender services, the policies are often very nuanced with according to your branch of service, your type of service. Are you active? Are you reserve, National Guard? And people forget there's about 56 National Guards out there, all of which have their own policies. And then, policies for your family members who may be transgender are different. And so it helps to have access to almost like a one-stop shop so that even if you don't find the policies within the guide itself, like, okay, so who else are some experts? Because when you're just coming out, you're nervous, you're afraid, you're not sure whom to trust, who can you go to? An internet search may or may not be a good friend for you. And so it's a wonderful tool to have that, to be able to say, okay, so where do I start? How do I begin? That's one of the things that with SPARTA that we pride ourselves on, is that for folks who are in the military, if you are one of the subject matter experts on, okay, so what are the policies for, say, Air Force, active duty, or Marine Corps, and how do I do this? And what kind of medical care can I currently receive? What is DoD policies? What do I have to out myself? How do I change my gender? How do I change my name? What do I do? And what kind of respect can I expect? Am I a protected class? All these questions are handled and answered in DoD policies and then also by branch policies. But when you're just starting out, it's a little bit overwhelming. And so that's where it helps to have the resources such as this.
Thanks, Alleria. And I recently heard from another transgender service member that in order to change their name, they had to submit a signed letter with documentations, photo ID, with their legal name to 8 separate offices. I don't know if you had to face something like that yourself, but I wanted to bring it up because it was something new that I had recently heard. And I know that, and I'll also defer to you all at the VA to kind of provide what your thoughts and feedback are now that the process is streamlining a little bit more.
Well, it certainly varies the process again, according to your branch, um, and where you're stationed and how smoothly. And ultimately, it also, your commands will have different information. And while it is a process, as we all know, commands sort of add their own flair to policies and procedures and rules and regulations. So it helps to know, okay, what exactly do I need to do? When I was coming through to change my name, the basis was that you had to first of all have it signed by a mental health care provider. Then you had to have it changed from an outside source. The number one easiest, fastest, and simplest way to change your name is through a U.S. passport. It is fantastic, and it is like one of the highest levels of identification. So whether or not you have a state that makes it easy for you with your ID card, your driver's license or not, if you get a passport, the federal government, which the Department of Defense, of course, is a part, will recognize that, and Social Security recognizes it. So it's a step-by-step process. And just like so many things in the military, you have to do the steps in the right order to achieve the best results. Once you do, then it's just a matter of waiting for the paperwork to sail through. And then one day you log into your computer and all of a sudden you notice that is the right name. So in the meantime, it gets a little odd. At one point, I had 4 different identification cards, one with a male name, male gender marker, one with a male name, female gender marker, another with a female name, male gender marker, and another with a female name, female gender marker, all of which were perfectly valid and completely correct at the time. So it's just part of the transition.
Well, thank you. Ashley, I'm going to go to you next. With the Freedom to Serve Guide, we also have new information pertaining to veterans benefits and LGBTQ inclusive care through the VA. What key information do you want veterans to know about the resources?
Well, thank you so much. And you're absolutely right. A lot has changed over the years. As somebody that served under DAT, I've been able to see firsthand being under stringent policies and then having the freedom to serve, just like this guide instills. And then also having the question mark of, well, what now? After I get out off of active duty and I hang those boots up, what's there for me? Who's there to support me? So, traditionally within VA, yes, we developed a program health office, but there was really nobody to help both sides of the coin. We always have questions about benefits and healthcare, and a lot of it goes hand in hand. And up until recently, we didn't have anybody to kind of fit that mold, and we didn't have a home as LGBTQ plus veterans. We have a home now. The secretary had asked the Center for Minority Veterans to take this role on, and so we have built out an LGBTQ plus liaison arm to fittingly go with all of our other arms that of that intersectionality, right? And so we do have a home now. We're here to support you. We do understand that we've got a lot of work to do, right? So one of the big things and challenges is identifying that lack of trust between the LGBTQ plus veteran community, their families, caregivers, and survivors, and the VA itself, and where those gaps are. That old saying of you've been to one VA, you've been to one VA holds true to this day. And our fellowship team has really taken a human-centered design approach to figuring out where those gaps are. Is it within certain, VA facilities? Is it with certain individuals? What are our veterans experiencing? But when we say veteran, we encompass everybody in that package, right? So the veteran is at the center of everything we do, which includes family members, caregivers, and survivors. So we have to reach out to all of the above to figure out what is their lived experience. Where have these experiences happened? And we've really done a great job of uncovering a lot of information that we have to go ahead and dig deeper into, which is part of research, right? So this fellowship is going to expand past just this year, past next fiscal year. There's a lot of changes that we have to make, but it's our veterans and our family members, our caregivers and survivors that can let us know their experiences, and we can know what we need to fix and what we need to work on as a whole for VA. So we do encourage folks to reach out to their LGBTQ plus care coordinators at every facility. Seek them out, use them, they're there for you. We really want to emphasize that. The center, we also have MVPCs, which is our minority veteran care coordinators. Some of our LGBTQ plus VCCs and our MVPCs are dual hatted, and it's the same person fitting both roles. They're there to support you. If you ever are in need of anything, you're finding yourself in a challenging predicament, whether it's with your healthcare team, whether it's benefit side, please come talk to the center. We can actually help you. We can get you in contact with those care coordinators if you're not sure where they are, with our MVPCs on the ground to help kind of walk you through certain processes, get to know your care team provider, and that whole facility in general. When it comes to the benefit side, we work hand in hand with VBA to ensure that we're handing you over to somebody trustworthy. We work with veteran service officers throughout the country to ensure that you're getting the most up-to-date information and help with your claim as well. One of the biggest questions we have is, what's the status of my claim? Well, we can help you. You just got to come to us and let us help you through this rigorous process. It's different for each individual veteran. So we do encourage everybody to reach out so you can see what benefits lie there for you.
And I don't know if you already said this, but do you have contact information for how people can reach your office?
Absolutely. I will put that in the chat, but you can actually go on VA's website, so va.gov, and if you scroll all the way down, there's three really great resources. You're going to see women veterans highlighted, LGBTQ plus veterans, and minority veterans. Those three links will get you to three separate pages, but we all share interconnected information, and we can all help bridge the gap to get you to what office you need.
Great, thank you.
Can I add something? Also in the chat, I went ahead and placed the LGBTQ plus veteran care coordinator locator tool. So that is a link that you can go to. It's a public website, just like Ashley was mentioning, and you select your state, and then you would select the facility that you belong to, and then your VCC location would be located there.
So much for sharing that. And Susan, for you and Puja, the guide has a section on Veterans Administration benefits, particularly including healthcare guidance for LGBTQ and transgender veterans. So what do you want them to know about the clinical care that's available?
I can start, and maybe Susan can also add. I want to echo what others have said, Ashley and Alleria, about how much things have changed just in the last year or so. For the very first time, the VA actually has a systematic way of collecting our sexual orientation and gender identity information. Really for the very first time, we actually are starting to understand those health disparities and begin to understand how to address them. So I do want to echo that point. As was mentioned, it is VHA policy that all VA staff provide clinically appropriate and veteran-centric care with respect and dignity to all of our veterans, and including our LGBTQ plus veterans who have served alongside all other veterans in a very affirming environment. I want to mention two specific VHA policies, VHA Directive 1340 and 1341. Susan can certainly speak more about that. Those really outline the roles and responsibilities for various entities, ranging from facility level staff all the way to central office, and really how to provide healthcare for our veterans who identify as LGBTQ plus, and the focus really being that there are provisions in place that this care is provided in a manner that's consistent with the policy. In addition, I think as Ashley spoke about the VCCs, the veteran care coordinators that are at every facility. They are liaisons for LGBTQ plus veterans, and really support the implementation of these national policies to ensure that our veterans are receiving equal access and culturally competent care. In terms of clinically, in terms of sort of what sort of clinical care is available, this means that veterans have access to all indicated care, such as HIV prevention and care services that was mentioned a little bit earlier. We know that that's a disease that disproportionately affects our LGBTQ plus persons, certainly veterans, and any other preventative and treatment services that are clinically indicated. Specifically for our transgender and gender diverse veterans, we provide, the VHA provides, care at any stage of gender transition. The policies outline the two policies that I mentioned. I think 1341 is the one specific to gender diverse veterans. It outlines the care available to the veterans, ranging from gender affirming hormone therapy. There's voice training, prosthetics, hair removal. In addition, letters of support for gender affirming surgeries. As you all are aware, due to VA regulation, the VA currently does not provide initial gender affirming surgeries. But it does address any medically necessary complications that are related to surgeries that veterans receive outside the VA. So really, I think our goal in the last few years, there's been a focus and a lot of progress, hopefully, that we'll continue to make in this area. And our goal is that when an LGBTQ plus veteran walks through the doors of any medical facility, that they have equal access to medical care, and it's delivered in an affirming environment. And I will again, echo Ashley's point about if you've been to one VA, you've been to one VA. There are lots of variabilities, but we have to keep on, making sure that each VA facility is complying with these policies. Susan, I'll stop here.
No, I think you got everything wonderfully covered, Puja. I also went ahead and added in the chat. I know Puja mentioned the policies, so I added the link there. You'll be able to see our directives, which is VHA Directive 1340, healthcare for veterans who identify as lesbian, gay, bisexual, or queer. And then VHA 1341, which is providing healthcare for transgender, gender diverse veterans and intersex veterans. So along with other information that may be helpful to you. So I highly recommend that if you haven't looked at our policies, that you take a look.
Great, thank you. I'm going to stay with you all for the next question as well. Many LGBTQ veterans did not receive DoD discharge upgrades if they left the military under less than honorable conditions for homosexual conduct prior to the repeal of Don't Ask, Don't Tell. What do you want them to know about the VA's character of discharge review process and the benefits that are available to them through that?
Sure, so I'll be answering this one. Just to kind of quickly describe, just only because a lot of folks actually don't realize that VA, although very large, has three different, I call them buckets or administrations that fall under it. So you have VBA, which is Veterans Benefits Administration, which I'm sure you've heard that acronym a lot. And VBA you go to for things like your home loans, your insurance, your voc rehab, education, things of that nature. You have Veterans Health Administration, which is where Puja and I fall under. And that is for, when you're walking into your VA medical facilities, you're getting your health care through a VHA. And lastly, if you didn't know, we have the National Cemetery Administration. So obviously taking care of those who have passed and their families. So when you look at VA, there's those three different areas. I will add a link to everything that I'm about to talk about. I will add a link to how to apply for a discharge upgrade. But essentially, even with a less than honorable discharge, you may be able to access some of VA benefits through the character of discharge review process. And when you apply for VA benefits, VBA, so another part of VA, reviews your record to determine if your service was honorable for VA purposes. And then this review, and I warn you, this review can take up to a year. So it's quite a lengthy review, and they are very upfront of the timeline, because you will see that on the website, they actually mention that it takes up to a year. You may want to consider finding someone to advocate on your behalf, depending on the complexity of your case. And essentially a lawyer or a veteran service organization, a VSO, and I can add that link as well, can collect and submit supporting documents for you. So I will add the link to how to apply for a discharge upgrade and then how to find a VSO. Essentially, though, when your application is being reviewed for eligibility, you can be treated for the following: anything related to sexual assault or harassment from any time in service, and any emergency mental health issues. Congress passed a legislation that allows VA to provide ongoing mental and behavioral health to certain former service members with other than honorable discharges, including those who were on active duty for more than 100 days and served in a combat role, or experienced sexual harassment or sexual assault while serving. And if this is you, if you have an other than honorable discharge, all you have to do is go to your nearest VA and tell them that you were a veteran with an other than honorable discharge and that you're looking for mental health care. So essentially, that is what VA can cover while you are going through this review process.
Great. And I just shared a link as well in the chat that includes some of the resources that we've compiled on our website, so people can access either legal services. The Veterans Consortium, for instance, can help you get a discharge upgrade. And I'm sure Susan's list will include quite a few of those groups as well. I am now going to go to you, Ashley, and ask, there are many former military members who do not consider themselves veterans or do not know if they are, which means they may be missing out on benefits they earned during their service. What do you want these individuals to know about what services there are, particularly around the PACT Act?
Thank you so much. Firstly, I want to say to each and every single veteran out there, first of all, thank you for your service. Your service matter. You matter, and welcome home. We don't often hear this, and I want to make it known that your service mattered. I often hear from folks, because of their experience within the military, serving before DAT, during DAT, and even after DAT, especially our transgender service members and our gender diverse service members, they feel that their service really didn't matter because of the policies that were in place. But your service did matter, and you matter to VA. So I want you to understand that you are missing out on benefits that are set aside specifically for you, the individual. I hear a lot of things from a lot of people, and one common thing I hear is, I don't need it, I don't need the money, I don't need the benefits, I don't need the health care, and I don't want to take away from another veteran. You're not taking away from another veteran, I promise you that. When you signed on that dotted line and you put on that uniform, we're here to take care of you. Those are your earned benefits, and they're set aside for you. So you're not taking away from anybody else. So please understand that. Now, talking healthcare side, you might not need it now. I know sometimes we're young, we feel pretty good. We hit that, upper 30s after retirement into 40s. Things start to go a little bit, knees get a little achy, and all those old injuries start to come back to life. So while you might not need healthcare today, you might need it next week. You might need it a few weeks from now. And we have studies that show that because you are eligible for this healthcare, you're actually saving a lot of money with, regular insurance, whether that's through your employer or you're paying out of pocket, things of that nature. So I encourage you, please check VA out. Again, you've been to one, that's one VA. So try another VA. Folks change, things change hand. Please reach out, see what you are eligible for. Every veteran is different. So we would have to take a look at your documentation, make sure that if we do need to do an upgrade for your character of discharge, we can walk you through that and help you through that process. We can get you through the claims process a little bit easier and have somebody there that we know and trust to help you through that process. So I encourage you, please talk to us. One thing that is new is the PACT Act, and a lot of folks are confused about what the PACT Act is. Toxic exposure. A lot of people think that you have to have boots on the ground in those areas for a certain amount of days. You do not. It's also encompassing airspace as well. So if you have a question, if you have an inkling, you're reading the documents that we put out there, you're reading the website, and you're saying you're still having questions about PACT Act and your eligibility, talk to us. We can walk you through the process. It's very easy. Filing your claim is very easy with PACT Act. We are processing those first. A lot of times we will look at it and see that there are other benefits that you're missing out on because of it. Things that you were denied before, you're now going to be eligible for. So please just come talk to us. There's also another conception out there. A lot of folks think, well, I have a disability rating, right? If I put in for a PACT Act claim with new items, or maybe it's making something worse, is that going to decrease my current rating? No, it is not. Please, if you have questions, do not hesitate to reach out to us. We're only a phone call and email away, and we would be happy to sit down with you and kind of go over what's out there. For my survivors out there, we do know that your veteran might have been serving in these areas, and now that they are past, you might have a lot of questions of, would have they been denied early on? They might have had a weird cancer that came up, and that's what they passed from, but you were not married at the time because of DOMA. Then please reach out. There are ways that we can submit your claim to see if you are eligible or your veteran was eligible for benefits under PACT Act. So again, individual case-by-case basis. It's easier once we have the paperwork in front of us and we can walk you through any processes.
Great, thanks, Ashley. Alleria, what information or resources within the guide do you wish you had known about during your service?
I think I touched on this just a little bit earlier, but to say it again, the collection of information, the how to do it. So it's almost like so you're in the military and you're transgender, or so you're in the military and you're LGBTQ. Now what? What do I need to do? What do I have to do? What do I not have to do? Do I have to come out to my command? What rights do I still have? What are my privacy rights? What are my healthcare rights? What all of those in there, to have that in a single location is just wonderful, and it's taken years of work by so many people of finding it out as it's been developed, to compile this effort of the how to do it as we've learned, as we've gained our ability to serve and our freedoms and our permission to serve the country, whether we're open or not. We've always served, but now we can do so openly and to fully take advantage of the benefits and the rights that everyone else has had. It is a wonderful opportunity, and to have it in that Freedom to Serve guide, that is huge. Just to be able to go, okay, so this is how to do it, and if I don't find my answer here, here are the places I can go to look, and that is wonderful.
And I also wanted to highlight that you dropped some resources in the chat for transgender persons who are interested in joining the military, and what they need to know and how to do it. Do you want to speak any further to that?
Oh, yes, because the policies are nuanced, even for if you're joining the military. How long have you been transitioning? Are you stable in your diagnosis, things like that? And so again, the policies are such. And when you go to basic training, what gender do you go by? How are things addressed? So we have a specified group of subject matter experts who know for each branch how to talk to your recruiter. What documents do you need? What is basic training going to be like for you as you go through? Are you eligible, or do you need to wait a few months to meet time guidelines? So we call it SPARTA Trans Future Warriors, and we have a Facebook group you apply to it, and then we talk you through what are your concerns, what are you hoping to do, and we answer all your questions.
Awesome, thank you. And now I'm gonna come back with one final question for you, Susan and Puja. We know that LGBTQ veterans or their family members may experience discrimination based on their sexual orientation or gender identity when they're seeking healthcare services at the local VA. We've touched on that a little bit. What is the VHA doing to ensure that culturally competent care is provided to veterans and their family members within the community? And what guidance do you have for individuals who face discrimination in their local VA?
Yeah, so I can start us off. So in general, right? So all who visit VA campuses or VA facilities should expect to be treated with respect. Of course, sometimes that doesn't go the way that we would hope. And so what we're doing on VA side is making sure that our providers know what the directives are, know what the policies are. We do provide training to our providers. We use our LGBTQ plus veteran care coordinators who are on the ground. So they are at the facilities as a way to make sure that if a complaint comes in, that maybe it's a specific department that needs a little extra training, a little extra sensitivity, just training in that manner. We use our VCCs in that way to make sure that anything that comes in, that we are trying to do our best at a VA facility within the VA. We also have, and I mentioned policies, and of course, we would hope that everyone would follow all of our policies. But essentially, we mentioned the 2 directives that we have that you can go through to our link. And those directives specify in more detail that requirements that VA places of care to be inclusive and validating. Additionally, we have other policies that kind of fall under. So when you're looking at rights and responsibilities of VA patients and residents of community living centers, this one in particular states that veterans won't be discriminated against for any reason, including sex, sexual orientation, gender identity, or expression. We also have another one that says rights and responsibilities of family members of VA patients and residents of community living centers. And this one in particular states that VA uses a broad understanding of family, including anyone whom the patient or resident considers to be family. So just be very mindful of those as well. Those are also located within the link. And of course, like I mentioned, we strive to have the LGBTQ plus veteran care coordinators at every VA facility who can help advocate for you. And additionally, every VA has patient advocates. So if something happens, and I apologize on behalf if this has already happened to you, and I hope that nothing does in that matter. But if it does, just know that you have your VCCs who can step in to take corrective action. Also, the patient advocates, you have a right to go to them and let them know of the incident. And as with any other type of major complaints, you have a right to call the Department of Veterans Office of OIG, the OIG hotline, which I can put in the chat as well. And you also have the right to call the White House Veterans Complaint Line. So just know that anytime that you use those, VA does take action. We want to hear about anything that's going wrong, anything that VA could be doing better. We know we never want any veteran to walk in or not want to walk into our VAs because they feel like they're going to be treated, mistreated, misgendered, or discriminated against.
Right, thank you.
And also you're always welcome to reach out to your local Congress representative. So just be mindful of that as well.
Absolutely, that's a great point. I also wanted to highlight that MMAA has a incident reporting form for discrimination, whether or not that's LGBTQ or HIV discrimination, and it could happen to whether it's happened to a service member, a military spouse, or family member or veteran. You can report that on our form, and I've dropped that link into the chat as well. So, and it doesn't necessarily have to take place at a VA, but we'll be making sure that if we get those types of reports, we'll be passing them along to the VA as well.
And actually, thank you for saying that. If you don't mind me butting in again, if you are receiving care out in the community, just know that those community providers also have basically signed a contract with VA saying that they will also abide by VHA policies. So if you are experiencing any type of discrimination outside of VA, because let's say you were sent out to a community provider, just know that you have rights. Obviously, you have rights as well, and we need to know about that as well. And there is a complaint form that you can fill out. I don't know if I could drop that in the chat, but it's basically a PDF that for you to have in case something like this happens. And like I said, I'm not saying that I want this to happen at all to anyone, but in case something like this happens, you know that you have a right to also come forward and say, hey, this community provider did X, Y, Z, and I'm not okay with that.
And for organizations or individuals who are looking to be more culturally competent, I also want to highlight that MMAA has a Rainbow Shield program, which is a online certification, and it provides culturally specific and trauma-informed linguistic, administrative, and environmental resources and knowledge on how to effectively work with LGBTQ and HIV positive military and veteran communities. So if you are seeing issues within your local community and you want people to become better educated, then reach out to us and let us know, and we can help lead those types of trainings. And, you know, I want to wrap up and give you all the opportunity to add any additional information you might want to share before we end our call.
Well, thank you firstly for doing this and putting out this great toolkit for folks. I think it's really important, and I'm really excited to see that it has been revived and has been added to. And I just want to make sure folks understand that while you are on a VA campus, that is federal property. So our federal property supersedes state law. So please, please, please understand that. Know that you are protected. Our physicians, our staff are protected as well. So it's a safe space to come. If for whatever reason, you know, you are going through the process, you're with your patient advocate, and you feel that even your LGBTQ plus VCC is not able to help you, maybe you think they are getting pushback from their leadership, please do not hesitate to raise your hand and say something. What we don't know, we can't fix. So we need your help as well to ensure that everybody's doing the right thing and that all of our veterans, our caregivers, family members, and survivors are treated with the dignity and respect that they deserve. And thank you again for your service.
I'd like to add on to that. You know, first of all, we're talking a lot about veterans, and so if you're watching this and you're currently in the military and you think none of this applies to me, you're a future veteran. This is coming to you, so definitely look forward to it and pay attention. But also, we talk about how to do complaints, but let's also, whenever we have someone who really gets it right and nails it, treats us with dignity and respect, does, you know, is affirmative, it offers the care, just makes you feel like you're welcome to be there. Let someone know, because they need to be recognized for that too. It's not just hitting the bad ones down, hammering those down, but also raising up the ones who are getting it right. Let's know who those are. Let's celebrate them, because oftentimes they may be swimming a little bit upstream in their culture. And so let's highlight whoever gets it right and really excels, celebrate them. So call them out as well.
Thanks, Alleria. And I just dropped, because Alleria mentioned this to me earlier, we created a form on the website that actually allows you to, you know, share those allyship stories, because we want to make sure we can amplify them and show the positive aspects of what's going on in the community. Does anybody have any other final thoughts? Or
I just want to say thank you so much for having this forum, and Alleria, thank you so much for saying that. That was such an important point. I think, you know, we always talk about culture change, and especially the headwinds we're feeling these days. And sometimes it can be very disheartening. So those positive stories are so important to spread that change, you know, culture change within our organization. So thank you so much for saying that, and thank you to all of you for your service as well. I feel very humbled to be on the panel.
Well, thank you all for joining us. I'm really pleased that we were able to come together on this panel discussion, and you all have contributed a great deal of information. I will make sure to also make sure these resources are shared, not just in the chat, but when we share the video as well. So thank you all.